He's lying on your stomach. Today I'm going to show you how to mess somebody, work on somebody. Okay, the thoracic spine. You have a scoliosis. It's like,
I didn't think so.
side is fine. You want to palpate. You want to feel. Get a sense of things. And then you ask the person, do you work a lot on the computer?
Yes.
So it is. It's going to be right here. Every time it's going to be right here. Because what do we do with the computer? This. Yeah. And it's okay. It is what it is. My advice to anybody who has a computer job is don't judge yourself for your posture. Just correct it and then go back. And when you slouch again, correct it, go back. Work. Eventually you'll get the hang of it and your body will start to remember to do this automatically. And it will do it. So suspend judgment. Oh, I have very, very stupid body mechanics. Don't do that to yourself. You're not a stupid person. Nobody can be stupid. Okay, so why do I cross my hand? It gives me a lot of pressure in one specific area. Breathe. And again, no need to make noise to move. Now we've been doing what did I just say? Oh, I thought it was glass. I have this thing, my feet are attracted to glass. And so is my butt. I break sunglasses with great regularity. That's why I get my sunglasses from Walmart. Okay, now this is another way. Okay, breathing through. No, her back is going anywhere. I think her back is in San Francisco. All no flesh, weight, body weight.
Uh-oh.
You try and keep the bone away. Okay, the positions are, and it explains to some of you, ulna flesh, palm down. Ulna, the bone, palm up. Elbow. That exposes the elbow. Okay, don't be afraid to use your elbow. You need the pressure. It gets very specific right in here. Yeah?
Yes.
So it is seriously, and your elbow, but you don't have to put all that much pressure. You just need to be accurate with it and sink. If you don't need that, if they can't take a lot of pressure, put more weight on the front foot. Take the weight off the front. Then it sinks in. So let your body weight do the thing. A little bit about body mechanics. Try and keep your spine straight, and don't worry about it. Just put it in a straight place. And if it bends, it bends. What are you going to do? You're going to full weight in a body mechanics. Can you wait a minute? Just do the move and keep going. Her thoracic spine is kind of funny. There's another thing you can do. It's kind of challenging, but you can help.
You want another person instead?
Huh?
Do you want another
No.
person
No.
instead?
You're the person here. Not that I don't want anybody else, just that you're here right now. Okay, now you're on the table with them. Okay, so breathe in and out. And what's happening is again, it's a lot of weight. Okay, and don't think that because you're just like your size. Oh no. That's not about this. You can do. The thoracic spine is something everybody is used to. Like the whole idea of standing there like this and somebody grabs you on the hand and goes. Okay, everybody's used to the thoracic spine. So a lot of times you really don't have to engage their cooperation. But as you get either down or up, when you start doing a few things, then you want their cooperation. Because these two things, if you think about it, they're mirrors for each other. There are 7 cervical vertebrae, 5 lumbar, sacrum, coccyx. Okay? So they kind of mirror each other. C1 and the tailbone, the coccyx, are the opposite ends of the spinal cord, spinal system. Okay? Sacrum, C2. And the sacrum kind of allows the rotation like this, just like C2 allows the rotation like that. And then 3, 4, 5, 6, 7. 1, 2, 3, 4, 5. And then you have T1 through T12. And the idea is to reduce compression in the spine, allow for nerve communication to be open, and circulation at times. I mean, when the nerves are communicating, the circulation gets better, the spinal fluid flows better. So that's that part. Now why do I do the shoulders here? This is the upper thoracic spine, but it's also the upper ribs. And you can either take the rib out of under the collarbone or reset the rib in the, in where it joins the spine here. And you can do that on both sides. And I have to do it on the other side. I did the one here. Who was it? Where is she? You! Because I did that to her the other day. And her first rib disappeared out of under her collarbone and she felt a little better for a while. But it's apparently not done yet, so. How's it feeling now? Yes? Okay. When we did a little, I barely even did a cervical adjustment on her, the thing went back in. I didn't even have to move, I just moved it a little bit and it went. Okay, so that's the thoracic spine. And you are dealing with discs and nerves and vertebrae. So you want to use some force, but you also want to gauge how much you need with a given person. Everybody's different. It's like when you're doing massage on people. You might have the same, like I have the same routine I do with everybody. Do I do it the same way? No. Different pressure, different places, different times. Because the person's stress can be located in different places every time they come in. So you're going to do different things in different places. You can have the same routine, but applying it is the unique part. So where you cater, you design your treatment to the person on the table, and you design and redesign and redesign and redesign as you move up and down the body. I watched Auntie do that a lot. She showed us the whole routine. Whenever I watched her work privately, she rarely used the routine. She did what was important for the person in that moment. I mean, yes, you could see similar tools and things like that, and this and that and this and that. But more often than not, she's diagnosing and checking and feeling and seeing. Like that. You guys have done some good work. For some of you that I feel for Nate there. You hear that moment with this left knee. Have you checked that? Yeah, that thing is really that's causing a lot of moments. Well, does it matter? I don't know where it is either. If I step on the table, the left knee is over here because that's where it was when I was on the other side. Right? Yeah. This one. Don't you know your right from your left? Sure. My right hand, my left hand. This is for right lift, right? And always when you're dealing with thoracic spine and or any other spine, shoulders, hamstrings, the uha over here. Very, very important because what that does is it pulls the pelvis this way when it's really tight. Hamstrings pull the pelvis this way. So how are you going to establish that, get that going? There's some deep work you can do. I did it on, who did I do that with? Who was the person on the table when I went? Oh, you were. When I did your hamstring. The hard part with leggings is it tends to pull them down. So you grab here, like this, without doing a wedgie. And you just go. And you want to go in between the two major muscles. The major muscles being the biceps femoris and the semicranial. Semicranial is over here. And you can do that one too, but on this side, you're going to get a little up close and personal with the person on the table. But that's just where the tendon is. But when you loosen this, it releases the pelvis. It helps the pelvis relax. When we loosen the thigh, it helps the pelvis relax. And all of those will help this relax. It'll add to the relaxation that's already there from what you've done. Questions?
You're adjusting the back. You're pushing downwards or you're pushing upwards?
This one here, down. This one here, forward. This one here,
Oh, anyway.
down. So it all depends on where you are and what you're trying to accomplish. If nothing is moving, you may want to come here and do one to go up like that. See if that's where you need the adjustment. Because sometimes, and you'll feel it when you're in a chiropractor's office, they don't always do the same thing twice, necessarily. You know, they can't get it this way, then they have to check this. If you see a chiropractor who is also a kinesiologist, they do muscle testing, they will test to see which way they have to adjust. So anyways, this thoracic spine is not as complicated. You can do this too. You get in the rib cage over here and just nice, easy pressure. You see that little motion I'm doing there? It's hardly anything at all. It's just, you get the pressure down like this. One time you just shoot through your arm. You don't need to, you put a rib out for a person and it's like, I got exuberant once, and I will tell you that I've done this. You know, that's how I know these things. When you put a rib out, it hurts them. And she was very nice about it. And we worked on it a little bit more. And the next time I said, I'm coming over to your house tonight. We're going to work a little bit more. And when I did, I was able to undo what I had done because of my exuberance. So let the body talk to you. Be aware of the person on the table. Not everybody's going to make a lot of noise, but things are still going to move, especially in the thoracic spine and in the cervical spine. But we're going to really focus on this a lot. And the lumbar spine. So today is like trying to focus on your work today will be on the thoracic spine. Okay? For the remainder of the time that we have here. And I don't know what time is that. How long are we working for? So we started kind of late, so is it okay if we go over a little bit?
For 1 hour?
Huh?
For 1 more hour?
Possibly that long.
Or 5.
Does that work? Okay. Because are you good with that? Feel? Nathan? Huh? Okay. Cool. Partner? Yes.
Does it matter which arm?
No, what you're comfortable with, you know? I mean, let's see. I'm comfortable this way. This is the way I do it. But that's for the straight down movement. So that's how I do it. If you're more comfortable this way, then you do this way. Sometimes it's a twist. Because the vertebrae is like that. So you twist it back. The other way.
And when you're doing the up one,
Yeah.
your arms more
Alongside the spine. They're alongside the spine. The spine's going to go. You're not on the spine. Even this one, you're not on the spine. Very good question. I forgot to tell you that. You're really not on the spine, you're alongside it. You're not on the vertical, no. You're alongside when you do the adjustment.
more comment on one hand.
No. You're trying equal pressure.
Can you kind of go to the last that's where you go to that point, or you can do like this?
I tend to go right in here and as low as the 12th thoracic. You can be careful with the 12th thoracic because of those extra ribs. After the 12th rib, there's a couple of extra moments here, including the floater. You want to be careful with that. And you can do this move down here too. If it, you're going to get some motion no matter what you do. It's nice to hear a pop, but that's not always what's going to happen. And that's the hard part about doing workshops. By the time we get to things, everybody's all, oh, and you don't need it anymore. But always in your assessment moment, look at the hamstring. Because a lot of times this is going to